resolved. So, COVID is important, right? It's a serious issue. So we all should wear masks, and I'm gonna give you reasons why we should wear masks. COVID constantly changes. So from different age groups, different people, COVID affects them differently. So that's one of the reasons why we should wear masks. The more people that are masked, the more protected we are from spreading the virus. Masks prevent particles from spreading, but they also prevent you from breathing in particles. So wearing a mask, if you're not social distancing, using the 6 feet or the 15-minute rule, you speaking to somebody with the mask on not only protects you, but it protects them from getting COVID. When wearing a mask between two people, it's better protection between the two. So, for example, say if I'm wearing the mask and I'm talking to Theo, and Theo's wearing the mask, not only are we both protected, but because we have the mask on, there's also an extra barrier between the two of us because we're not spreading the particles, you know, me breathing it in from him breathing it in from me, different things like that. If you wear a 50% effective mask, the disease transmission drops down to 75%. You have 4 different routes within that number that I just gave you. Say if neither people are wearing the mask, 0% of the disease has dropped. If one person wears a mask and another one is contagious, the 50% disease transmission has dropped. Again, the contagious versus the person with the mask, again 50%. And then if both are masked, then you get that 75 disease transmission dropping. That's pretty much it for the beginning of our debate.
Resolve. There are a lot of questions that the population has started to question regarding COVID when the pandemic started, during all of it, and even after it. And one of the main ones is if masks should be mandated or if they should be worn. And there are a few reasons why we think masks should not be mandated by a government. My main point is the misuse of masks and the ineffectiveness that this causes. There are also different consequences that wearing a mask can cause, and people are the main affected by it. Some of the misuses are the following. When people wear masks, they think that they're already safe from anything, but that's not true. The virus can be spread by coughing or sneezing, but there are other precautions to protect us. Since apart from being infected by swallowing or breathing this air from these coughs or sneezes, we can also be infected by touching a surface with that infection there. If we touch that infected surface and then we take our hands to our mouth, eyes, or nose, we can get infected that way too. So not just masks protect us. As virus cannot be just like spread like that, we can also it can also be spread by touching. We should maintain a distance with people and washing our hands. Try to see which other ways of protecting ourselves can work, and these are 2 of them. My other point is that there are also different kinds of masks. For example, cloth masks or filter masks, and some of them get ineffective. All masks have a limited time of hours that we should wear them. So if someone uses them for too long, they need to be replaced. If not, it gets ineffective. Cloth masks, for example, if they don't get washed, pathogens can accumulate in them and be ineffective, or you can get infected by the virus that those pathogens bring to you. Another point is that when people wear masks, air inhaled and exhaled from it, it's unfiltered around the edges. We get air unfiltered from the edges of the mask. So wearing it doesn't fully protect you either. And it doesn't protect the person wearing it or the environment around them. And another point is that if you touch the mask on the outside, going back to my point of like touching infected surfaces, we can also bring those pathogens and particles to the mask and get infected like that. So apart from the ineffectiveness of mask protection, there are also problems that masks can bring to different groups of people. Those people with breathing problems are the main affected by them. They struggle breathing when using masks. They should be able to not wear them, and they should not be forced to do so, since if they already have chronic obstructive pulmonary diseases, they already struggle breathing even without a mask on. So my last point is the fact of needing other measures to stay safe. Like I said, like social distance or washing our hands. So after all, masks should not be mandated, since there are also some existing risks of wearing masks. People should decide which risk they're taking.
All right, we've heard our opening arguments. Now we're going to hear our first round of major evidence.
All right, so I'd like to begin by saying that though my opponent team is correct in saying that the virus can be traced off surfaces, and there are different consequences, as she has stated, it does affect other people, and that's my point, is that it affects other people more than yourself when you do wear a mask. So, wearing masks protect other people from me and should be mandated. So the other people are often more protected than I am. If we're both wearing a mask and it is mandated, then there's a higher chance of slowing the spread of the virus, up to 75%, as we said before. This is with wearing cloth masks, not including wearing the N95s or the higher rated masks. So if you were to wear those, there would be a higher chance of slowing the virus. So again, with the argument that wearing the mask for a long amount of time will cause other diseases and infections. Even if you wear them for a short amount of time and you're aware of changing them, that would still be beneficial. So to tell a personal anecdotal story about wearing masks, about a year ago when COVID was at its peak, I went to a party. Don't do that. I went to a party and I was taking pictures, not with just my phone, but a camera. And so the camera was up close to my face. And there was a gentleman that was also at the party, and he came knowing that he had COVID. There were about 30 of us in a very tiny house, and he knew he had COVID and came anyways. He used my camera and took pictures with it and then gave it back to me. Shortly after, we were all tested. Every single person was quarantined. I had just started a job at the bank, and I couldn't start my first 2 weeks. So that is an example of not wearing a mask and being irresponsible, not thinking of other people, but rather just yourself. So wearing masks and having them being mandated is not just a scientific issue, but also an issue of respect for other people. When you don't wear a mask, there's an immediate face value of disrespect for one's decisions and opinions. So masks need to be mandated.
All right. Let's start off with the legal part of imposing a mask mandate. So first off, legally, yes, the United States government can make you wear a mask in a state of pandemic. However, in the case of COVID-19, should the government impose a mask mandate? Is it justifiable? And no. Here's some reasons why. The Congressional Research Service stated in August 2020 that the federal constitutional precedents made it implausible for the federal government to issue a national mask requirement that would apply to all 50 states. The Congressional Research Service also stated that the anti-commandeering clause of the 10th Amendment prohibits the federal government from compelling state officers to carry out federal commands. So as a result, this principle bars Congress from compelling states or local governments to impose mask mandates. So this means even if there was a mask mandate from Congress, it's ultimately up to the states themselves. So after hearing that, it's clear that a nationwide mask mandate is a bit useless. So let's talk about a statewide mask mandate and why it's not justifiable either. Let's face it, masks do not impose that big of an importance when it comes to COVID-19, unless it's a certain kind of mask, an N95 mask. This type of mask isn't like others. This type of mask is made from high-tech synthetic fibers, and these N95 masks are usually used by healthcare workers in hospitals or people who deal with COVID patients every day. Most people haven't worn an N95 mask regularly during the pandemic, despite it being the most effective. Scientific American Online states that N95s are the only masks that should be used to protect ourselves from COVID-19. However, the CDC says N95 masks should only be used in healthcare settings. Cloth masks are labeled as completely ineffective if a person does not wash it after every single use. We can guarantee how many people actually wash their masks. So according to a survey from the hygiene technology company Living Guard, 80% of people who use reusable cloth masks do not wash them in between uses. And 8% of these people admit that they do not wash them at all and never have. So this is alarming considering studies show detectable levels of the virus can be on the mask for up to 7 days. Surgical masks, on the other hand, can be used once for 4 to 6 hours and then thrown away. So 80% of people who have a mask on are basically not wearing a mask at all because it's ineffective, and N95 masks usually last about a week and are reusable, but should be reserved for the nurses and doctors who are on the front lines battling with COVID patients every single day. So in conclusion, if a mask mandate were to take place, cloth and surgical masks are just too hard to keep up with and have too many user errors to be effective. If we ignore the CDC's advice and begin wearing N95 masks, we would be taking those away from the people who truly need it most.
All right, we're going to now take a 5-minute intermission for you to gather your rebuttals. All right, ladies and gentlemen, we're going to reconvene with our first rebuttal from the opposing team.
Let's talk masks and how they can even lead to people's passings. Mr. Lee had lost his son in gym class while wearing a mask, and it happened within 3 to 4 minutes. While running and required to wear a face mask, Mr. Lee's son had collapsed, hit his head, and passed shortly after. The boy had passed wearing an N95 mask. Now his autopsy report came back as cardiac arrest, so you're probably thinking it has nothing to do with his mask. But according to the National Center of Biotechnology Information, there have been case reports of sudden cardiac arrest with the wearing of face masks during exercise. Mr. Lee had this to say about the whole situation. It was sunny, and their PE class was in the afternoon, and it was at least 20 degrees Celsius, 68 degrees in our temperature. It couldn't have been comfortable running. Mr. Lee's son, gym class was outside, so they had plenty of opportunity to be 6 feet apart and social distance. But instead, they forced masks. And maybe if they didn't, he would have been alive today, and he might have had a better chance of surviving. Now, masks for everyday use, and temporary, and especially temporary masks made from fabric, these grant no protection from the user from being affected. However, it is safe to assume there is a small risk reduction from droplet transmission, especially during breathing out and exhaling into your face mask, resulting in a potential in reducing the viral spread. But if these masks aren't exchanged regularly or washed properly, they become useless. Pathogens can accumulate, and reinforcing Alva's point, when used improperly, the risk of spreading pathogens, including COVID-19, might be critically increased. Also, breathing dampens the mask, and its excessive moisture becomes airtight. Therefore, the air inhaled and exhaled is unfiltered around the edges, like she was saying, losing its protective effect for both the people that's wearing it and the environment they're trying to protect outside. Removing the mask also needs to be done the right way. Most of us touch the outside of our mask, which we shouldn't do at all. And we should wash our hands before touching our mask anyway. But since most of us doesn't do that, the mask becomes contaminated and it loses its protective properties to begin with. Now, when it comes to protective face masks, they should be reserved for healthcare workers, hospitals, and care facilities. This applies to surgical masks and filter face pieces. Now, let's move on to what the CDC has to say about social distancing, quarantining, and how useful face masks can be. It has been proven that face masks are not effective. According to the CDC, if there is a benefit to having healthy people mask up, the effect is likely to be small. No one should assume that they are protected by a face mask. It is critical that people continue to stay 6 feet away from others and continue to wash their hands. As the CDC says, face coverings isn't a substitute for social distancing. Let's not force people to believe in false solutions when we have for sure solutions that work. Now, let's look how Germany handled their pandemic. In Germany, the COVID-19 pandemic has been more contained in European countries or even worldwide. However, we are not immune to this infection. It is imperative to implement any measures to control the spread of the infection, or at least the speed of the diffusion to the population. It is important to note that Germany's healthcare system didn't deplete its resources. Theoretically, we are affected by mass scarcity, and like other nations in the country. People who risk their health or even their lives need to be protected. They're the ones that need to be protected. There should be a fine balance when suggesting preventative measures, since reinforcing them indiscriminately may contribute to psychological discomfort, acts of violence, and even financial strain. Now, what gives us the liberty to have control over people's lives? We need to give that choice to the people. There are other options such as washing our hands, social distancing, quarantining, and even the vaccine to this mask mandate. So again, I ask you guys, why are we forcing mask mandates when we have other solutions that work to COVID-19?
Well, our opponents have stated several other ways that we could help stop the spread of COVID-19. That does not exclude masks from helping. It doesn't say that they don't help, it just says that they're not the only way. We have lots of laws to help us to not have car accidents. Speeding is a law that a lot of people disregard, completely ignore, because there's not a way to perfectly control whether people speed or not. We still have speed limits. There's not a way to perfectly make sure that everyone wears a mask exactly the way that they should, exactly the mask that they should, washes it all the time, but that doesn't mean that it's not necessary to have mask mandates. It's still helpful. The CDC says that masks should be worn until we have reached herd immunity. One of the problems with statewide mandates without other mandates throughout the whole country is that it creates problems with herd immunity. So it's still important for us to be consistent across state lines. It also makes traveling difficult. So if I'm from Michigan, so I came from northern Michigan to go to Bethel. There's different mandates in Michigan than there are in Indiana. And so if I don't pay attention to the mandates that are in Michigan and I don't wear a mask or whatever, I bring something from there and I bring it here. And that's because I was not paying attention to mandates, and it's because state mandates were different across lines, because there's less mandates in Indiana than there are in Michigan. Even though healthcare workers should have access to the N95 masks, they are still masks that us as citizens should be wearing. We do still have access to them, even though we might not have as good access as the healthcare workers. And if we were actually wearing masks the way that we should be, our healthcare workers might not have to have as many patients with COVID-19 to deal with.
All right, we're going to take a 3-minute intermission so you get your final rebuttals and closing arguments.
So one point my opponent brought up was that being on the roads, we all have speed limits and we do not follow them. The same can be said about masks though, because we have mask mandates and we do not always follow them. But I'm going to take you on a short history lesson to compare COVID-19 to the 1918 Spanish flu pandemic. Back in 1918, the Spanish flu hit and killed 50 million people globally and 675,000 people within the United States. So far, the coronavirus has killed 5 million people globally and 746,000 people within the United States. However, back in 1919, one of the most successful places in controlling the spread of the Spanish flu was New York City. Now you may be asking yourselves two questions. What did New York City do that many other places didn't? And how does this compare to the coronavirus? I will answer both of these questions within my talking. In 1919 New York City, they didn't shut things down and require masks. In fact, Dr. Royal S. Copeland, the city's commissioner for the Department of Health, allowed the city to stay unmandated from masks. He isolated anyone who came down with the flu or sent anyone home that had any symptoms. His first move was when the Norwegian vessel the Bergensfjord arrived in the New York City's harbor. He quarantined any member that was infected by the flu and isolated them. He then started with the school system by having doctors at each school check each student before they entered to make sure that they did not have the flu. If they had the flu, they were sent home. His main rationale here was that many children living in New York City were living in impoverished conditions that were far worse than the school system and the health care that they could provide. To the general public, he printed out pamphlets that told people how to protect themselves, how to prevent the spread of the disease, and how to treat it. One of his biggest issues was how to control the transportation system in New York City. So he met with owners of many of New York City's bigger businesses to stagger the opening times of their businesses to prevent congestion within the public transportation areas. After cases started to ramp up, Copeland gave out guides on how to control the hospitals during a pandemic. The main difference between Copeland and New York City to other cities is that they chose not to close down, but to identify and isolate those who were infected, all while not having a mask mandate. The city saw a death rate of 4.7 people per 100,000, which is better than the two other major cities on the eastern seaboard, in Boston and Philadelphia. In Boston, they had a 6.5 people per 100,000 death rate, and in Philly, they had a 7.3 people per 100,000 people. Now, before you say they didn't have our technology, many people in the 1920s wore masks made of cloth and elastic, as many of us do now. The second question that I will answer is how it compares to the coronavirus. Both viruses give similar symptoms as the other: a cough, a runny nose, a sore throat, fever, headache, and fatigue. They spread in similar ways by the way of droplets from infected individuals and entering a person's system by touching their mouth, eyes, or nose. They also have the same list of higher risk individuals, including elderly people, people with respiratory problems, and people receiving suppressive treatments to certain diseases, such as chemotherapy for cancer. Lastly, the protective measures are very similar to one another. These measures include social distancing, avoiding crowds, and cleaning hands frequently. To conclude, the flu did not receive a vaccine until the 1940s and still kills people during the flu season despite having a vaccine. Therefore, COVID is something we are going to have to deal with regardless if we wear masks now to prevent the spread of the disease.
Now, my opponent brought up a 100-year-old sickness, the Spanish flu, and I'd like to take us back a few hundred more years, back to the Black Plague, the sickness that wiped out just the majority of Europe. And I'd like to point out that even then, there were plague doctors, people that wore basically what we would compare to hazmat suits today. They wore masks, they wore gloves, they wore all kinds of things to try and not die from said sickness. And well, while they were wrong at the time about the mask part, at least, it was the rats, it was the fleas that got them, not the airborne sickness. It was the caution and the precaution that I want to bring forward. I agree with a lot of what you said about what happened in New York. I think that was great. But I also think that the masks are an extra defense against sickness that can kill many, many people. Like you said, about 747,000 deaths and 46 million cases in the world for COVID. And there were 50 million deaths from the Spanish flu, which is more than there were cases of COVID in general. What has a part in that? I mean, obviously, I would guess masks anyway, because it's such a, what's the word I'm looking for? Contagious, such a contagious sickness. And why wouldn't there be more? Why wouldn't there be just as many, even, cases of COVID as there were of the Spanish flu? And I think that masks and proper isolation, as he said, are the main reason for that. And even back in 1918, about 100 years ago, people mumbled and grumbled about masks. But I think that came mostly from selfishness, much as it does today. And I think that a mask worn can be a life saved, and that's a caution worth taking.